Dr Layla McCay is director at the NHS Confederation. They represent NHS service managers, and she joins us now. Layla, very good evening. Obviously, the figures are not going in the right direction at the moment. I gather in the northwest, one of the Nightingale hospitals has been taking patients. Is this a pattern you think that we're going to see more widely now?
I think it's certainly very concerning. When we look at what's happening in the northwest, actually, the northeast and Yorkshire are starting to catch up with that and perhaps even overtake it. The hospitals are starting to see more and more coronavirus patients, and I think that everyone in the UK should be concerned that this is a trend we're going to be seeing elsewhere.
Now, of course, in the first part of the pandemic, there were concerns that we didn't have enough ventilators. There were lots of people in the ICUs. What is happening now in hospitals? Are we seeing the same proportion of people actually having to go into ICUs and using ventilators, or is there a different pattern developing?
Well, what was helpful is that we've learned a lot from the first wave of COVID-19 about how to best treat patients and how different types of patients respond to different types of treatment. So it is the case that not everybody needs to be in intensive care on a ventilator. There are other appropriate ways to manage certain people. So it's hard to make a comparison, but certainly there are people in intensive care units all over the country, but certainly that number is growing in those hotspot areas.
When we talk about the NHS being overwhelmed, and of course that was the key message from the government right at the beginning of the pandemic, that all of their strategy was geared towards the NHS not being overwhelmed, and it wasn't in large part. I don't remember there being many stories of hospitals saying, well, we are now at breaking point. What numbers do we need to look out for now in terms of sort of thousands of patients within the system? Because presumably if one hospital does get overwhelmed, people can go to Nightingale hospitals or maybe transferred to other areas.
It's not quite that simple. You can't make a direct comparison because in the first wave, essentially many services were paused. Many treatments were delayed so that those people and those facilities could be used to treat patients with COVID-19. And of course, as we all know, there was a consequence to that, which was an increased number of people waiting for their treatment who are all now very keen to have that treatment. And of course, people developing more symptoms and coming in seeking healthcare for all sorts of reasons. And the aspiration this time around is to be able to maintain all those different services alongside treating patients with COVID-19, which of course requires extra capacity from staff, extra capacity for beds, all of those different things. And it's a real challenge because A, all the infection control measures actually reduce the capacity a bit, and B, staff are exhausted. There are lots of staff shortages. There's quite significant staff sickness. And C, we're going into winter where we, as we all know, see increased pressure on hospital beds at the best of times. So there's a lot of things that are converging together, which mean that our members tell us this is going to be a very difficult winter.
Now, the whole care home issue seems to have dropped out of the headlines. I do detect a Scottish twang in your voice there. You've seen the story today about care home residents in Scotland. I think 113 of them were discharged from hospital after testing positive for coronavirus in the early weeks of the pandemic. The report says that they don't think that actually contributed to clusters of outbreaks around Scotland. But Nicola Sturgeon, I think, has admitted that they got it wrong. How can that be avoided this time?
Again, it's all a matter of learning and understanding what the right thing is to do, using testing very wisely and making decisions that are sensible and patient-based rather than any sort of blanket rules seems to be the order of business here. I think that everybody is very conscious of potential risks of moving around staff, moving around patients, and it's really important.
Why did it happen then? Because you represent NH service managers. Presumably they will have made those kind of decisions. And I don't think it was just in Scotland, it was in England as well. How could someone make a decision to transfer someone who had tested positive with coronavirus into a care home?
Well, at the end of the day, decisions were made based on risk assessment and evaluation of what the most appropriate thing to do for those patients were. As we know, it's not good for people to remain indefinitely in hospital, and it's particularly challenging when you need those hospital beds. And at the end of the day, it's really important to get patients being treated and being cared for in the right environments for them. Having a lot more testing now is going to be a lot more helpful to give us the insights into the most appropriate and most helpful things to do.
Layla, thank you very much. That's Dr Layla McCay, who's a director at the NHS Confederation.